All right. Hey, everybody. Welcome back to Ask Our Vet after a 2-week hiatus, brought to you by Rockwell Pets Pro. Each week, we're going to be discussing the hottest topics in veterinary medicine. I'm your host, Mike the Voice Monkey. As always, I'm joined by Dr. Max, a 2018 graduate of Tufts Cummings School of Veterinary Medicine and full-time veterinarian at the Village Veterinarian in New York City, unless he gets hurt, since the summer of 2020. We are here. We're back. We're here to answer your questions. If you have any questions, put them in the chat and we will answer them today. Dr. Max, we've been off for a couple weeks. What's been going on?
Yes, we have, and pardon me if there's any
Can you hear me?
technical. You were going in and out, but I think I got the gist of it. Can you hear me? Okay.
I can hear you just fine.
Excellent. Yeah. So what's been going on? Well, unfortunately, what has led to this 2-week hiatus was that I had gotten bitten by one of my patients, a cat. And it happened 2 Mondays ago. And, I've heard horror stories from friends of mine in the field who have, I've been scratched many a time, but unfortunately, or fortunately, it gotten to this point where I had never been bitten by a cat, but finally happened. And I'm hoping it's the last time. But it was a pretty bad infection and cellulitis, and it got to the point where within really 12 hours of the bite, my hand really just swelled up, and I started losing the ability to, just with all the inflammation, to actually, move. And
Wow.
it was mostly my index finger, my middle finger, but also a little bit of my, even to my pinky and my thumb. And I'm just very grateful that I'm, returned to full function. I'm back at work now. And, but it did lead to a 4-day stay in the ER, which was unexpected, unanticipated, but very grateful to be out. And my wife was there for me the whole time and took such great care of me. And just a lot of fluids and antibiotics and pain meds, and made it through it.
Where on your hand did you get bit?
Well, I don't know if you're quite able to see. Well, it looks a lot better now, but it really got me here on this joint. So that's the index finger, and then between the index and middle, and then it's hard for me to do this right there as well. By far the worst was the one that was right here, because it just narrowly missed the joint capsule. And I think the doctor said millimeters away, and that would have made for a whole different prognosis. But even so, it was no fun. I was really out of commission and unable to do anything with that hand for, I would say, a week. And then slowly I was able to kind of, each day I would try to start to do a little bit of movement. And even while I was in the hospital for the first 2 days, it was just getting bigger and bigger. So they were waiting for the culture to come back to see if I needed a different antibiotic than the one they had put me on. But in the end, it was the appropriate one. The culture Pasteurella, which is very commonly seen in cat bites. So what I was on was appropriate. It just took a while. It took its time. It took its time to actually make a difference. But that was the situation. And in addition, sorry.
Was it a patient? Go ahead. Was it a patient that is normally upset with you guys, or was this out of the blue?
It was out of the blue. Unfortunately, it was a first-time patient, and it was a patient it was a 7-year-old cat, spayed female cat, who presented for a couple of days of inappetence and some vomiting. And they had come to us. They didn't have any previous records. They did say that the cat was up to date on rabies, but they didn't provide any documentation. And unfortunately, we didn't have that. So I ended up having to get rabies booster and tetanus vaccine and all that jazz. The one vaccine that I requested but they didn't give to me was the COVID one. So, unfortunately got vaccinated, but not for the actual injections I wanted. But yeah, so that cat, it didn't seem to be so aggressive for the vast majority of the exam. It was when we approached her oral cavity to administer a pill, which I very, very rarely would do for patients in hospital. I had ordered an injectable medication, an antiemetic, and we didn't have it at the time for whatever reason. It was out of stock, and I guess the last bottle was used in our hospital. And but we did have the oral form, so I was going to send it out to the owner, and they asked very nicely and requested for us to give it the first dose in hospital. So I tried, and then the cat flipped out, and I was unfortunately the casualty. Yeah, I think it's just a combination of the technician was doing a good job straining, and it was just kind of all of a sudden that neither of us had anticipated that she was going to freak out. She did, and I learned a very valuable lesson, and I feel like I came out of this with a lot of gratitude, even though it was not a fun 2 weeks. I learned my lesson. I don't think I'm ever going to do that again, and I'll have to be honest with the owners about pilling a cat, because we've done it before, but no cat wants to get pilled in the hospital. I don't want to have it done at home either, but I feel that they would be more amenable to it in a comfortable environment, something they're familiar with. It's literally the first time the pet was here. So it happened, and I'm grateful to be back working, and had my fair share of fractious cats yesterday and today as well. But thankfully, no one was harmed.
Right. Does it make you a little gun shy now?
I feel as though I'm not going to be, as yes and no. I feel that I can't let it really impair my doing my job, but I will definitely be more conscientious when it comes to, looking in cats' mouths. And, sometimes cats have horrible dental disease and it needs to be taken care of, or if there's a fracture or whatever the case may be, and, I'll address it, but not to my detriment, or not to potentially lead to that, because it's really not worth it. And there's always better ways, with sedation, to be able to take a better peek. This one just kind of caught me off guard, because, the cat was doing fine and not showing any aggressive behavior prior. And, you look at the ears being back, there's a lot of bodily cues that we can look to, hackles and the hairs on the back standing up. And this cat wasn't showing any of that. So, sometimes, putting ourselves in their shoes, and if something was 20 times my size trying to stick something into my mouth, I probably would be reactive as well. So, that's the situation.
Yeah, being as long as I've worked in this business, we've been bitten and scratched and everything like that. And rarely does it kind of come out of the blue. Normally there's a chain of events you can kind of go back to, like, well, maybe we should have done this or should have done that. And that kind of set him off, and that, kind of thing. But when it comes out of the blue, especially a cat, I mean, a dog, you can just put a muzzle on him and the dog's pretty much neutralized. But a cat, it's like a Cuisinart sitting there on the table, just waiting to get you with all his claws and its teeth and everything like that. So
it's true.
Cats are tough. I don't like dealing with cats. We've had cats that have gotten loose and were running around the room and trying to kill us.
You
understand.
And then they defecate everywhere too.
Yeah. Oh yeah, anal glands and all that. But I think that with yeah, oh yeah, all of you. But the thing I think people would find interesting is that's the aspect of the job a lot of vets don't talk about, is that yes, we are dealing with animals and they can bite us and they can scratch us. I know there's owners that are horrified when their pet, bites the tech or bites the vet or scratches or carries on or whatever like that. And I think it's interesting to see it from your perspective and how people from the outside looking in and go, yeah, we get bit, we get scratched. I've been torn up by many a cat, and I've been bit by dogs. And sometimes that's the kind of the part of the job that people don't necessarily like to look at. They think, oh, my dog is perfectly fine.
Of course. Yeah. I mean, I was forthright with those owners too. Like, I wish it hadn't happened, but I ended up telling them that it did. I didn't shy away from that fact. And they were pretty horrified, especially, it was their first time there. We hadn't had a rapport prior. What I also had tried to do is, while I was in the hospital and everything, what I, really wanted to have was the records of her vaccination. And so I had my receptionist who was, working the days prior, subsequently when I was in the hospital, to call them, and they just wouldn't pick up. And I'm like, we ran blood work on your cat because, she was not feeling well. We wanted to communicate those results to you, and they didn't answer. And I wonder if, it was, they didn't want to come back. They were afraid of, litigation or, who knows what. So I don't know why they never wanted to follow up on, the service that we provided for their cat. And hopefully she took the medication at home and, is doing much better. But it's unfortunately one of those things that's lost to follow up, at least temporarily. But yeah, I mean, it's like, it definitely is a huge part of the job. I've been scratched so many times. I just remember one that I got like a month before my wedding. And I was just, I just wanted to heal up and in time. But it's, occupational hazards are real. We wear dosimeter badges for radiology, especially for female coworkers. It's definitely something to be aware of and monitor. And for sure, like every patient, safety for us and themselves is, the paramount.
I think the further I got into my career, like early on back in the 90s, it was, you've got a fractious animal. It's like, well, just hold them down and we'll muzzle them and they'll be fine. But the further I got into my career, I think the thinking changed. And you've got a dog who's fractious or a cat that's fractious, sedate them. Hey, can we sedate your pet? And that's easier for everybody involved, I think. And it depends on how far the cat's gone at that point. If the cat is completely wigged and you can't even do anything, to send the cat home. The cat's our best. It's not going to do any good. Somebody's going to get hurt. The cat's going to get hurt. But if you could stab them, with a little, Tealzol or something, and then they go night, then everybody gets to, treat the animal and do fine, and the animal wakes up at home like, what happened? But you're right. I mean, a cat comes into the clinic and you got somebody who's gigantic going into their mouth. I don't blame them for wanting to fight back. It's still tough though.
Yeah, I think we can just breathe more easily.
I'm glad you're better.
Thank you so much. I really appreciate it. I'm glad I'm better too. It was, I was really nervous for, the first couple of days, but once I started to turn the corner, I, a lot happier.
Well, when they said you were in the hospital, I was like, oh my, how bad was this bite? It must have been pretty bad. How soon after the bite did you end up in the hospital? Was it right away?
Well, so I thought about it. I thought immediately when it happened, I knew that this was pretty severe. It was definitely the worst because I've been nibbled by dogs and, been grazed, but I knew this was probably the worst bite that I've gotten. And I had a friend who had to have surgery when he was bit by a cat the next day. And so I was percolating in the back of my head, but I was thinking, what? I washed it off thoroughly. I was able to compress and ice and take pain meds and sleep through the night. That'll be my game plan instead of going to the ER right after work. And then the next morning, so the bite was my second to last patient of the day. And the day was like going really well. I was like really pleased with my progress, and everything was going on time, and it was just one of those really everything was working day. And then this happened out of the blue. And then I had my last patient to see him and discharge. And then I'm like, you know what, I'm tired. I'm going to go home, get dinner and whatnot, and just ice and take pain meds. And I thought, it'll be okay. The next morning, it was so red and inflamed, and I knew that I was going to have to go to the ER, and I'm thankful that I did.
Cats' mouths are gross. And they always talk about how gross dogs' mouths are, but cats' mouths have so much bacteria, and their needle teeth, boy, they can put it deep into your hand. So
that's why they're worse than dog bites, no joke. For sure. Yeah. It could have caused osteomyelitis, gotten to the bone, and that's, you're talking a much, much longer course of treatment. And, could have gotten to the joint. I'm just, counting my blessings.
Yeah, absolutely. Now, we're very thankful you're fine.
Thank you. The most annoying thing for me now is just as I'm healing and everything, it's starting to get itchy. And that's kind of the annoying part, but I'll be all right.
Yeah. And you definitely get a little gun shy. I think when you're in there, you kind of PTSD a little bit. Cat goes, looks at you and you go, hey, no, I'm cool. I'm cool, cat. It's cool. That's cool. I don't want to go in the hospital again, man. You leave me alone. I'm all right. So
True.
Cool. Well, I guess we can get to our topic for tonight that we were supposed to have 3 weeks ago, but now we are on it tonight. The topic is pancreatitis. Probably the only term that's harder to spell than diarrhea is pancreatitis. Lots of vowels in there. I guess we'll start with the obvious question. What is pancreatitis?
Great question, Mike. Essentially, it's when the pancreas, which is this little L-shaped organ in the abdomen, becomes inflamed. It can lead to a lot of bad downstream effects and lead to a lot of symptoms in dogs and cats and people. Just I guess for those people who are interested, pancreas has a lot of different functions. It has a lot of different components, and there's like the endocrine portion and then the exocrine portion, and different cells in the different tissue of the pancreas are going to produce some enzymes that get released into the intestines to digest carbohydrates and fats. And then there's the hormones. Think of like insulin, probably the most famous one, that will be directly released into the bloodstream. That's going to be regulating blood sugar levels. And so those are like really some of the basic major functions of the pancreas. So what can sometimes happen, pancreatitis, is when some of those enzymes that are supposed to get released into the specific portion of the small intestine, hit up all the food that's been eaten. They usually get released there, but if they get released early, prior to making it that far, it can kind of start digesting the pancreas itself actually, and lead to a lot of inflammation and a lot of clinical signs and symptoms that owners will notice before they know, or they won't just know, oh, pancreatitis. They're going to be seeing all sorts of clinical signs at home that bring their dog to the vet.
And let's get into those. What are the symptoms? What should people be looking for?
So the big ones are vomiting, inappetence, abdominal pain, just ain't doing right, lethargic, and then fever would be really some of the main ones that we're looking out for. In people, like 90% of people who have pancreatitis are going to be complaining of like abdominal pain, especially on their right side. And it's not as high in dogs, but I would venture to guess it might not be clinically detected, like when a vet will be palpating the abdomen. But generally, it's a really painful diagnosis. So pain, not eating, vomiting, sometimes diarrhea, sometimes bloody diarrhea. Those are the big ones to look out for. And it's one of those things that can often be grouped in with other sort of gastrointestinal problems. So when a dog presents for this stuff, you may not know, a clinician can't know for certain, really without pancreatic biopsy for sure that it's pancreatitis, but you have a strong clinical impression. And certain things that it can, be thought to be as differential diagnoses would be like a foreign body obstruction or gastritis, so inflammation of the stomach. Those are kind of the big ones. Yeah.
Okay, we'll let people know who are watching. If you wanted to ask a question tonight, it doesn't have to be about pancreatitis. It could be about anything vet related or general trivia. It's fine. I'm good at geography or movies. You can go to the Rockwell Pets Pro Ask Our Vet page and register there, and you can ask questions. They'll show up here on my screen, and we'll throw them up as they come in. So you've got a dog, you think it has pancreatitis. How can you differentiate that between what are some of the diagnostics you do between that and just upset tummy?
Absolutely. So in terms of diagnostics, I think the first things that probably 90% of vets would be recommending to owner would be pulling blood, doing a CBC, complete blood count, chemistry profile, and what I would put on that additional blood test would be something called a PLI or CPL, canine pancreatic lipase immunoreactivity, which is a mouthful talking about so many syllables. But that is that's the enzyme that we're really looking for, that it's very sensitive or specific to pancreatitis. And so whereas, a dog who may have inflammation elsewhere in the body or in the gastrointestinal tract, if you run this CPL and it's not high, it'll tell you a specific value. I actually don't remember the 0 to 300, maybe normal, and then above that would be I don't know. I really
don't have it memorized.
No. But essentially that's going to be the one that will be the ticket to effectively rule in or out pancreatitis. That's kind of the gold standard when it comes to blood work that can be done to rule it out. And then additionally, you might find an elevated white cell count on the CBC. Usually though, that, and I think maybe in previous iterations of our little podcast show, we've talked about elevated white cell count, what that means. Really, it's just an inflammatory process going on, which pancreatitis is. But this is kind of different from, an infectious one, especially bacterial, insofar as, this is a sterile process. There really aren't bacteria or any infectious microorganisms that are implicated in the pathogenesis of the disease. And therefore, antibiotics you would not treat this with antibiotics. So even though a lot of times you may see a white cell count and someone may think, oh, we jumped to, doing some sort of antibiotic, that's not really, pancreatitis in dogs or cats will not really respond to that. But yeah, those are some of the diagnostics that I would, be recommending for a dog who came to me with those symptoms we talked about. Additionally, x-rays can be done, but they usually won't be able to show the pancreas. It's a pretty small organ in the grand scheme of things. Liver's way, way bigger. Stomach, these things are going to be more visible on x-rays. The imaging that would be able to show it better would be abdominal ultrasound, which we don't have in our clinic, at all times. We have an ultrasonographer who comes in and does that imaging like once a week usually. But so not all clinics have the luxury of doing that. But abdominal ultrasound would probably be able to show some changes to the pancreas.
What are some of the treatment options at that point? What would you recommend?
Yeah, so even before the diagnosis or the presumptive diagnosis has been made with the blood test, and some clinics have like SNAP tests where they won't give you a value for that CPL, that specific lipase enzyme, but they'll kind of just tell you like yay or nay, if you will, on this SNAP test. What I would recommend for treatment, first thing, the mainstay of therapy would be fluids, so IV fluids. Get an IV catheter into the dog, and put an e-collar around him, put him in a cage, get the fluid rate, and start that ASAP. And you can also, get some pain relief going in the line. Maybe a opioid like fentanyl, CRI, in with the fluids, because it's an incredibly painful disease. Just kind of pump the fluids in, and monitor. And this generally should be done so that a patient can be monitored throughout the day, overnight. I currently don't work at an overnight facility, but usually it's important to kind of monitor for development or worsening of symptoms like vomiting or diarrhea, and kind of address those with different medications if necessary. But what I would say would be fluids is the big category of treatment. Analgesic, so something for pain, and then talking about like antiemetics, something to kind of combat the nausea and try to prevent recurrence of vomiting from happening, which also may be helpful with stimulating the appetite. There's a lot of it's one of those things where you ask one vet or two vets, you'll get three opinions kind of in terms of what you do in terms of nutrition. We didn't really talk about causes of pancreatitis, and probably because no one really
we'll
knows.
Get there.
We'll get there. Okay. So it's one of those things where one of the potential factors that can be associated with pancreatitis is ingestion of a high-fat meal, shortly before symptoms may start. The day before, or earlier that day, owner gave some cheese pizza or something like that, or who knows what. That can definitely precipitate these episodes. And so in terms of getting, a patient may present with not eating for a day or two. And so do you continue to withhold the food or not? And I'll be honest, I've seen different patients with pancreatitis, and I do different things for them, depending on, how they look to me. And if a dog who comes in with acute pancreatitis and is really depressed, down, doesn't even, if you may be floating a little bit of Roacaine, really yummy, digestible, low-fat food in front of his or her face, he won't smell it or anything, then it's just I'm not even gonna offer it. But if the dog comes in a little bit more bright and alert, but has a lot of the other symptoms and may be willing to eat, I'm going to offer her a little bit of low-fat food, periodically through the day. But so that's kind of one of the things, being conscientious of what you feed her. And then especially once a patient has been hopefully successfully treated, giving the owner discharge instructions and making sure that they know that, foods that are high in fat, maybe the dog food that they're on, or if they're getting a bunch of treats, something off the dinner table that's really delicious, but probably not good for their health. Those would probably be contraindicated, and making sure that we kind of keep a check of that because they definitely could recur in the future.
Have you seen dogs get pancreatitis from, say, getting in the trash and eating a bunch of stuff that's in there?
Absolutely. That's like one of the, I would say like that is I can't assign a percentage, but that's a frequent flyer in terms of why dogs may get pancreatitis for sure.
Now, do you see is there a difference in breeds of dogs coming in, little dogs versus big dogs with pancreatitis? And does that change your course of treatment? Like Chihuahua versus a lab comes in.
Yeah, so I guess in terms of breed predisposition, there really isn't one, but I would say that I've anecdotally and in a lot of literature, miniature schnauzers are the breed that get this the most often, and I've definitely seen that quite frequently. But as far as treatment of a Great Dane versus a Chihuahua with this, I mean, I think the difference in treatment would be, the fluid rate, obviously, and how much of the dose of the specific medication. But I think it's more so the temp.
I mean, is it more serious in smaller dogs? Let's put it that way. Do they have a greater chance of becoming dehydrated or than a larger dog does, or is the survival rate different for the size of dog? We always used to see the little dogs come in with pancreatitis because the little dogs would always eat the whatever the owner would give them, something off the table, some bacon or some whatever, and next thing you know, the dog's coming in puking its guts out. So
I'm not sure, honestly. I don't know the answer to that question as far as difference between the large versus small breeds, but I don't know, but I would venture to guess that that is probably I really don't know. I can look into that, but I don't know about the survival rates. But it's one of those things where you get the diagnosis and you may find the specific number and where it relates to normal, where that canine pancreatic lipase is normally for a dog, and for dogs who it's way askew, and that may correlate with the clinical impression, and they may be down and out and super lethargic, vomiting all night, really painful when you pet their belly, but not even like they can't even move sometimes. And so the prognosis there, whether it's a big dog or a small dog, is going to be guarded. Whereas, if the dog's, maybe it's 400 or 450 and maybe not quite as high, as a dog with really severe acute pancreatitis, whether large or small, I would probably give a better prognosis. I have had a couple in vet school. There were a couple of patients with really acute pancreatitis who passed away. But generally speaking, it can be managed quite well, with pretty aggressive fluid therapy for 24 or 48 hours, I would say.
Is the prognosis dependent on how soon you start treatment? If people have been waiting for a couple of days and then they come in.
Yeah. I mean, I think that's a huge difference too. The longer you wait, the potentially more of the pancreas that could be, digested and inflamed, and it could become hemorrhagic and bleeding and, lead to peritonitis. And just the longer you wait, the worse prognosis for sure.
Is there a difference between chronic versus acute? Is there a chronic and acute pancreatitis?
Yeah, I mean, for sure, like certain dogs who, some owners don't assign enough weight to some of what they're seeing. And so they may, it's the first time patient or something, and they come to me and they said, oh yeah, my dog has been vomiting, he vomited, 4 times this week, but that's normal or something. And like, I mean, it's really not. It's and so you kind of have to convey that in a kind tone, but forceful, because obviously you're advocating not for them but for their dog, and trying to get them to understand potential severity of stuff. And talking about diet and definitely acute pancreatitis. If not treated, or if treated successfully, but the owners don't really do the requisite diet changes, it can definitely come back and last for longer than a couple of weeks, and be considered chronic, and may not, or no longer respond to the typical therapy that we would do. And then you may potentially start with steroids, which have their own potential side effects. I wouldn't jump to that in kind of an acute case, but that's kind of one of the differences that I would consider for acute versus chronic treatment.
Are the causes different between the two, or is it all pretty much this? It just depends on how long you wait.
Yeah, I mean,
whether it's acute or chronic.
Yeah, I mean, no one really knows. I'll probably start off with that. What we're taught in vet school, it's like, because of a fatty meal, and that's more of an acute thing. But if a dog is constantly getting, really high fat foods, or, treats off the table, getting to the garbage frequently, that could lead to elevated triglycerides in the bloodstream, and just this kind of basal level that promotes this pancreatitis on a kind of a chronic sense. But, so that's kind of the one thing, like the nutritional side of things. Then you have potential for drug-induced pancreatitis. So actually from corticosteroids, that could actually cause pancreatitis. Some anti-epileptic drugs can lead to, some gastrointestinal problems, including pancreatitis. And then there's the potential for, and I've not seen this in my, particularly in my time as a clinician, but there's been described like blunt force trauma, like, hit by a car case, or a dog that was dropped or something, and just like really bad trauma to the abdomen that may, cause pancreatitis. So those are kind of the causes that I'm aware of.
Wow, I don't know about that.
But no one. But then again, like, oh, sorry, what were you saying?
No, go ahead.
I mean, it's just one of those things where a client may come in with no history of any of these things, and they may have been feeding the same diet to their dog for years, and no change in exercise level, or dog didn't get into the trash, no new medication or anything, and yet they're presenting for all these symptoms. And so the doctor should definitely discuss that that's a possibility, and try to rule it out. And it's possible the dog may come back positive for pancreatitis, and treatment would be warranted. So it's just one of those things where it could be like idiopathic, and you don't really know how to assign a cause, but you can put your finger on it. You can do the test that shows that it's there, and then you can go ahead treating it. But that's kind of a scary thing, because you don't know what actually caused it. Like, I had a cat bite who bit me, and it hurt like hell, and then I got cellulitis and my hands full up. I know what happened. Like, imagine if I woke up in the middle of the night or the morning and without having the bite, I would be, even more freaked out.
Right.
So that's kind of one of the tricky things when it comes to, situations like this, especially, they can't, the dogs can't say anything. And if there isn't any history that the owner can share with, even the most diligent owners, they may not know of anything that could have precipitated it, even if you let them know all these potential causes. It's just one of those things where you just got to treat it if you find it.
A high fat, meal or a high fat diet can cause can lead to pancreatitis. Can it just a general change in diet? How likely is that to cause an inflammation of the pancreas? If you don't go to like a high fat, you just switch their food?
Yeah, I mean, I think that that's possible as well. Typically, and this is why we recommend to owners, gradual transition. And I have a lot of, I had a lot of puppies who came in today, and their owners are just trying all sorts of different diets in really short time frames. I had, this one 9-week-old dog that was like on from duck, and then beef bone broth, and then some other Stella and Chewy something or other, and diamond chicken. And I'm like, let's pump the brakes here. First off, this is my first time meeting your dog, and I don't mean to step in here, but your dog is coming in for diarrhea. I wonder, of the 1,000,001 causes, and we had our show on diarrhea a few weeks back, but there's so many different causes. It's possible the dog could have part of it. Like, I didn't smell it today.
Right.
And the dog was in good health and, feeling great, running around and curious and everything. But I'm like, I just wonder, let's try to isolate some variables here and, do away with all these different diets, and then maybe come to a closer ideal of what could be best to feed your dog. So she agreed to kind of only do the one diet that he had been previously eating and doing well on. But she had changed it because maybe he wasn't eating as much or not finishing the bowl or something. And some puppies are like that. So to get back to the question, how likely is a diet change to cause it? I don't know how likely, but I think it definitely could be a possible cause.
If a dog has had pancreatitis, how likely is the dog to get it again down the road?
I don't know the answer to that question. I'm sure there's 100 different variables that are involved, but I think the biggest one would be compliance. And I think that a dog would be far less likely to get it if an owner is going to stay on top of diet management, not be feeding stuff off the counter, keeping the trash locked in the cabinet or whatever, and maybe switching to like a Purina EN or like Royal Canin gastrointestinal low-fat diet, some therapeutic diet or something that is a little bit more indicated than a cheeseburger.
I think we can all go for that too. So, can you treat pancreatitis at? I know you should. Can you treat pancreatitis at home?
Can you repeat the question? The audio is going a little in and out. I didn't actually hear.
That's fine. Can you treat pancreatitis at home?
You can. I would strongly advise that you don't. Yeah, I saw that question. I'm like, if there's any takeaway that we've had from these sessions is that there are a lot of potential good home remedies and, less life-threatening diagnoses that can be, a vet visit can be put off, or, kind of like with telehealth, kind of ascertain based on symptoms, what might be a good approach to kind of treat at home. This is one that, if a dog, because the owner's not going to know if the dog has pancreatitis or not. I had an owner who came in, who didn't come into the clinic. We're all just talking over the phone with COVID these days. She brought her dog came to my clinic, presented to me in the exam room today, and I had a number of. Sorry, it's a cat. It's a cat. I had a cat owner. I had a number of like GI cases today. This cat came in, 9-year-old cat, and it had been vomiting for 2 days, And I asked if, the cat had, a history of like eating things that he shouldn't. She said that she has like been chewing on like plastic wrappers and bags and stuff like that. And so I do worry about foreign body obstructions and possibilities. And she said, and so like I told her, of the things we can do, blood work, antiemetic medication, x-rays, just to be on the safe side, as things that, she would need. And the owner was like, and then, you constantly get more information in the phone call, that's different from what, you had been told earlier that the technician had communicated to you. So I get more and more information. Apparently there's the other cat at home, the sibling who's also been showing these signs. So, what's the likelihood of that? And but when I told the owner, doing x-rays would be recommended, she said, oh, well, I ruled out a foreign body, or that, something that the owner was telling me that she ruled it out because the other cat was also showing symptoms similar. And I was just in my head, I'm like, oh, good on you for ruling that out. Like, I can't even rule it out. I would need, imaging. I don't know what your cat has right now. And pancreatitis was on my differential list. So, we're running blood work and we'll probably get some answers tomorrow. But in the short term, she kind of opted for the more conservative approach. And, that's, the owner's prerogative, of course. But, I did what I was entrusted by her owner to do for her. And at the end of the day, obviously, if she does come back positive, we will definitely be more keen on seeing her back, or suggest that she go to another hospital for IV fluids. But that was it was just funny to hear like the owner saying like, oh, I ruled this out, when at home you can only really do so much diagnostically and therapeutically. So pancreatitis, anytime if your dog is having vomiting, lethargy, inappetence, pain, if you're rubbing the belly and they may be wincing, I wouldn't play around with that at all, and I would definitely go seek veterinary attention.
Yeah, and who would have thought that both cats could eat the same thing and have foreign bodies? I'm glad we ruled that out.
I'm glad we ruled it out too. Yeah.
I mean, they're both vomiting. No way they could have both eaten plastic bags and had plastic bags inside of them. So in terms of, in addition to a lower fat diet, what would you recommend people do to prevent pancreatitis? Either prevent it in the first place or prevent it from coming back after they've had it.
Yeah. I mean, essentially what you said, it's really dietary management, being, having the owner aware of the symptoms, which may recur, keeping a dog adequately hydrated, I think is a big one. And just general, healthy lifestyle and, adequate, exercise. I don't really think that there's a specific, like, if you're overweight, you're more likely to, get it or not. But I think generally speaking, just, giving your dog a lot of attention, love, exercise, good nutrition, kind of on all aspects, trying to keep them and their gut healthy.
So I want to let people know, if they go to rockwellpetspro.com and use the code pancreatitis, they'll get a $10 off natural dog probiotics. Would a probiotic be good for something like this? Or is that more gut health?
More gut health. I don't necessarily know if it's going to specifically be, reached by the, into the pancreas, but definitely something that would be beneficial for, gut microbiome for sure.
You mentioned Royal Canin earlier. Is that kind of your go-to food to recommend for, well, pretty much pets in general, but especially ones that have had pancreatitis?
Yeah, I like Rogaine, Purina, Hills. Those are the companies whose research and development I am big big believer in, and that we keep in our clinic, and that we'll offer to patients who are hospitalized or send home with patients who get discharged.
One of the things I was curious about was when you're treating a dog with pancreatitis and the dog is also a diabetic, how does that affect the treatment, or does it affect it?
Yeah, that's a great question, and that's when I'll refer to the internal specialist, internal medicine, because it's just one of those things. Like, obviously, both diseases are rooted in the same organ, and it can get complicated. And there's all sorts of different drugs, and obviously, if a patient's on who has diabetes, needs insulin, daily or twice daily, and it can be very difficult. And so, how to do it? I mean, I think generally speaking, a dog who has severe pancreatitis will need IV fluids no matter what. And, kind of just being conscientious. Like, it's just one of those things that dogs who have endocrinopathies like diabetes or Cushing's disease, hypothyroidism, sometimes you can get overlap, and then it does complicate the matter. Another disease that we didn't really mention tonight would be exocrine pancreatic insufficiency, which can be a sequela or something that may happen as a long-term consequence of pancreatitis, especially dogs who have kind of the chronic form that goes on for a while and the owners aren't really addressing it. And maybe it's not the most severe pain and dogs are still eating a little bit, but, vomiting frequently and maybe eating less and maybe being a little more lethargic, and owners aren't picking up on it necessarily. If that happens, keeps happening, at some point, the specific cells in the pancreas that are producing those digestive enzymes, they'll be destroyed to the point where you'll get this condition, this insufficiency, EPI, that will lead to additional issues and kind of this, like the hallmark is like a yellow colored diarrhea. And that's kind of very commonly what is seen with that condition. And so that, of the things that we think about with pancreatitis, especially, I guess, the chronic form, is that, the pancreas has only so many cells in it, and as they're destroyed, it can lead to EPI, it can lead to diabetes, and then you need to start doing more frequent blood work to ascertain what the blood glucose, blood sugar levels are, and then potentially titrate up or down insulin doses, and then you have to be careful because if you go too high, you get hypoglycemia, and then that can kill a dog too. So there's like it's just one of those things where you just have to be very conscientious of how long things are going on and any additional symptoms that they may start to be seen. And with diabetes, like, you start seeing PUPD or increased your drinking and urination, lethargy, inappetence, all the non-specific stuff we've talked about. But again, those things would be picked up on a routine CBC chemistry profile. So like if a dog's having these symptoms, you don't just run the CPL, the lipase, to rule out only the pancreatitis. You kind of do the whole thing, the whole caboodle, if you will, in order to make sure that you don't have diabetes on top of everything.
Wow, that's a lot. So again, if people want $10 and use the code pancreatitis, well, we're wrapping up here. Dr. Max, anything else you wanted to add? Any other thoughts you had about pancreatitis that we haven't covered already?
Thoughts I had about pancreatitis? No, I mean, I think we hit a lot of it. I'm surprised that we were able to cover an hour. But no, it is a very painful disease process, but one that, if caught early enough, and dogs can definitely make a lot of improvement. And so yeah, fluids. That's my take-home message to everyone.
Excellent. Well, we're going to sign off here. We'll see you guys again next Thursday night at 7 p.m. Eastern. I don't know what our topic is next week, so it'll be a surprise for everyone. But it should be a good one. Dr. Max, I'm glad you're feeling better.
Thank you so much.
Keep improving with that hand, man.
Yes, sir.
Hands are a veterinarian's lifeblood. You can't do anything without those.
True. So it's true.
I'm glad you're feeling better. And
thank you.
I'm Mike, the Voice Monkey, and we will see you guys next week at 7 o'clock.